ma'am. I am Kyla J. Capa and I will be your nurse for today. May I confirm if you are Miss Robeline Gallardo?
Yes.
Okay. So today, ma'am, I will be assessing your eyes, ears, and your hearing. Is that okay with you, ma'am?
Yes.
Okay, so the importance of this assessment, ma'am, is for us to know if you have eyes, ears, or hearing problems that we need to focus on or get treated immediately. So during the conduct of this assessment, ma'am, I might need you to sit down, stand up, or shine light to your eyes. So is that okay with you, ma'am?
Yes, ma'am.
Okay, so I can assure you that after this assessment, all the results will be confidential and will only be discussed by healthcare professionals only, so you don't have to worry, ma'am. Okay, so as you can see, the room is well lighted and your privacy is already well attended. So before we start, ma'am, I will perform hand hygiene first. So we will start. May I ask, ma'am, if you have any family history of diabetes, hypertension, or eye diseases?
No.
When is your last visit in an ophthalmologist or optometrist?
I haven't visited anyone.
Okay. Do you currently use eye medications?
No, ma'am.
Do you use contact lenses or eyeglasses?
No, ma'am.
Okay. So, ma'am, I will be assessing your eyes first. So, I will inspect for the eyelids and eyelashes. Okay. So, the upper lid margin and the lower lid margin are in proper places. There's no white sclera is seen above or below the iris. The palpebral fissures is horizontal. The upper and the lower lid close easily and meets completely when it is closed. And the eyelashes are evenly distributed and curve outward. The skin on both eyelids is without redness, swelling, or lesions. Now, I will observe for the position and alignment of the eyeball in the eye socket. Okay, so the eyeballs are symmetrically aligned in the sockets without protruding or sinking. Now, I will inspect for the bulbar conjunctiva and sclera. So for this assessment, I will be using my gloves. Can you look up, look down, side to side? Look up, look down, side to side. Okay, thank you. So the bulbar conjunctiva is clear, moist, and smooth. The underlying structures are clearly visible and the sclera is white. Now I will inspect for the palpebral conjunctiva. Can you look up, ma'am? Look up. Okay. So the lower palpebral conjunctiva are clear and free of swelling, foreign bodies, or trauma. Now I will inspect and palpate the lacrimal apparatus. So there's no swelling or redness over areas of the lacrimal gland. Puncta is visible without swelling or redness and turns slightly toward the eye. There's no drainage noted from the puncta when palpating the nasolacrimal duct. Now I'll inspect for the cornea and glands. I will be using a light for this procedure. Okay, so the cornea is transparent with no opacities. The lens is free of opacities. Now I will inspect for the iris and the pupil. Can you look at me in the eyes, ma'am? Okay, so the iris is typically round, flat, and evenly colored. The pupil, round with a regular border, is centered in the iris. Pupils are equally normal in size. Now I will test the pupillary reaction to the light. So ma'am, can you please look at that object over there? Okay. So the normal direct pupillary response is constriction. Now I will test for the accommodation of pupils. So ma'am, can you please focus on this pencil? Okay. So the pupillary response is constriction of the pupils and convergence of the eyes when focusing on a near object. So now I will perform the corneal light reflex test. So ma'am, can you please look at that object directly to that? Okay, thank you. So the reflection of the light on the corneas are in the exact same spot of each eye. Now I will perform for the cover test. Okay, so now ma'am, I will be covering the other eye of yours. Okay, so focus on me, ma'am. So the uncovered eye remains straight, fixed ahead, and the covered eye remained fixed straight ahead after being uncovered. Now I will assess the 6 ocular movements to determine the eye alignment and coordination. So ma'am, please follow the movement of the light with your eyes only. Okay, so the extraocular muscle of the eye is properly working. Now I will assess the peripheral visual fields to determine the function of the retina and the neuronal visual pathways to the brain and the second cranial nerve. So can you cover this to your other eye, ma'am? And then please say now the moment you see my hands, okay? So let's go. Okay. Now, ma'am, that I am done assessing your eyes, now I will proceed assessing your ears and your hearing. I will inspect for the auricle, tragus, and lobule. I will inspect for the symmetry of size, shape, and position. And I will also observe for lesions, discoloration, and discharge. Okay, so the ears are equal in size bilaterally. The auricle to aligns with the corners of each eye and within a 10-degree angle of the vertical position. earlobes are free. There are no presence of lesions, discolorations, and discharge. Now, I will palpate for the auricle, mastoids, process for textures, elasticity, and areas of tenderness. Okay, so the auricle, tragus, and mastoid process are not tender. Now, I will perform for the whisper test. So, ma'am, can you please repeat what I said?
Long gown. T-shirt.
Okay. So, she's able to repeat the word that I whispered. Now, I will perform for the Romberg test. So, may I ask you, ma'am, to please stand and feet together. Okay, arms in the side. Can you close your eyes, ma'am? Okay, ma'am, so thank you. You can see it. Okay, so the client maintains position for 20 seconds without swaying or with minimal swaying. Now, document all findings in the patient's chart and inform the doctor or the nurse on duty if there are any abnormalities found. So now, ma'am, we are done assessing your eyes, ears, and your hearing. Again, I can assure you that all the results will be confidential and will be only discussed with healthcare professionals, so you don't have to worry, ma'am. So, thank you, ma'am. Thank you for participating in this assessment. And once again, have a good day.